Light is in abundance. So let's spread some of this lovely lights and roshni to a limelight with Masuma, hostess, pretty makeup artist, and a well-known beautician, Miss Masuma Papia. Miss Papia is the chief hostess of this segment filled with joy and glory. So why wait? Let's proceed on to the glorious moment.
Hello everyone, good morning and welcome to Limelight with Masuma. I'm your hostess, Masuma Papia. Limelight with Masuma is a TV show that focuses on promoting and highlighting business owners, professionals, upcoming trends and social issues. Most importantly, it's a show about people from different walks of life sharing their experience, their passion, their views and their expertise with us. So for today's episode, I'm excited to introduce a very successful professional from this area, Dr. Elizabeth Matteson Jones. Now, Dr. Jones is a well-known orthodontist who owns her own practice called Merrified Orthodontics. I know her very well because I've used her services. She's absolutely an amazing person, a great orthodontist, and most importantly, she is someone you can trust with all your ortho-related work. So welcome to Limelight with Masuma, Dr. Jones. Thank you so much for making the time to join us today.
Well, thank you so much for having me. I'm absolutely delighted.
I'm glad. Every time I go to your office, I just, first of all, I love going to your office. It's such a nice place to kind of come and get your ortho-related work done.
Well, thanks.
And everyone's so nice down there.
Oh, well, we love having you too, so thank you.
Thank you. So tell us a little bit about you.
Well, I'm a native of Northern Virginia, so I'm just thrilled that I get to practice in my hometown. I've wanted to be an orthodontist since middle school when I was born without one of my front teeth, and so getting orthodontics and a false tooth was just a huge, confidence builder, life-changing moment for me, and I have always wanted to do that for other people. So I'm just living my dream right here in Falls Church.
I would have never known. You have such a perfect smile.
Oh, well, I've had a little bit of orthodontic work.
Who knew? Well, trust me, if you told me, I wouldn't have known that you lost one of your teeth. But
I
guess that's what you do, right?
That's what I do.
So, one of the things that was my first question when I first came to meet you, and a lot of people want to know, I'm sure, is what does an orthodontist do? Like, how are they different from a general dentist?
That's a really good question that I get asked all the time. And an orthodontist really is a general dentist. You have to be a general dentist to become an orthodontist. Similar to you have to be a physician to become a neurosurgeon or a cardiologist. So an orthodontist has been to dental school after college. That's 4 years. And then we've gone to an additional 2 or 3 year training program where we focus on fixing bites, making teeth straight, fixing jaw problems. So really your orthodontist is only going to focus on how your teeth fit together and how they look, versus a general dentist is concerned about the health of your teeth, if you have cavities, gum disease, that kind of thing.
Okay, so it's a little bit more than what your general dentist would
so it's
do.
Additional training and more expertise.
Okay, so what are some of the typical problems that an orthodontist can help with? And I'm talking about it at any ages. I know, to be honest with you, before I came to see you, I really didn't know a lot about what to expect, and I was afraid to go to my own dentist, which I'm sure a lot of us out there. So tell me, like, what's a typical?
Orthodontics is great for any age. We see children as young as 7, and then sometimes, we're seeing adults up into their later years. People are keeping their teeth longer. So many adults who maybe didn't have orthodontics as a child are coming in and getting their teeth work done because we're living longer and we need our teeth longer. And hey, it is never too late to improve your smile.
I'm a perfect example because as a child I had braces but never took care of my teeth, so had to go back as an adult. So tell me, what's a typical age where parents should bring their kids to an orthodontist? Like,
that's a good question. A lot of people want to know that. And the Academy of Orthodontists, the AAO, recommend that all 7-year-olds be seen by an orthodontist to screen for major bite problems that are much easier to correct at a younger age. So the majority of children may not need early treatment, but we want to make sure that nobody is falling through the cracks.
Okay, because I know like now these days I'm seeing more and more younger kids are coming at a very younger age, and I was always under the impression that you have to lose all of your baby tooth in order to get your braces.
Of course.
So, but that's not the case,
Not the case anymore. A lot of times we're doing some early treatment where children have a mixture of adult and baby teeth, and we're doing some very specific goal-oriented work to improve future development of teeth, future development of bite, and so we're doing some early work which we call phase 1, and then a lot of times then they need a second phase of treatment when they have all of their adult teeth, where we're completing the foundation that we started from phase 1.
Oh, okay. So when I got mine, I mean, obviously I didn't follow through with retainer, you know, so it just went right back to, you know, what it was, and then so lately, it was not a good idea. And you didn't hear this from me, but I do kind of like wearing my retainer now.
I didn't hear it.
So tell me this, what are some of the things that an orthodontist covers? Like what
So there are many conditions that an orthodontist can help with, and there are some specific ones in children that we really watch for. Okay, so there are many pictures here that we've got to show you different examples of conditions that orthodontists are looking for, and these conditions are showing, depicting children with a mixture of adult and baby teeth. So you may have a single tooth crossbite where one of the bottom teeth is coming out in front of your top teeth. That's a concern because it can cause gum damage. You know, we can have back teeth that are in crossbite. Sometimes children have really severe crowding where adult front teeth are not able to come in.
And this is when all of their teeth, I mean, they have come out. This is when they've lost all
No, they may still have a majority of baby teeth.
That's very interesting.
You know, children with underbites or their bottom teeth stick out, that's a big concern. That's a big one that we really want to catch early before age 10, because after age 10, we have a harder time correcting that.
Oh, wow.
And then, of course, you know, some children have a hard time giving up habits like thumb sucking or finger sucking or lip sucking. So we have ways to help break those habits as well. And so those are some of the things, you know, that we are watching for. We're also watching to make sure that teeth are falling out on a normal timeline and coming in at a normal timeline. There are other things, though, that we look at once you get into all of your adult teeth. There are some of the similar problems with children we see in adults. So we can still have crossbites with front teeth or back teeth. But some things that are a little bit more special for adults are that as we age, sometimes we wear the edges of our teeth away, and our teeth begin to look very short. And you know, that's not beautiful. We want it to look better than that.
You know, it's interesting because you talked about crossbite, because that's like the first problem I had after taking the brace, and you had to go back and correct it for me because, or maybe it was just in my mind because I felt like it was not the right bite after braces came off. So can someone just continue to come in and have that checked up?
And that's part of why, you know, as we age, we start to notice our teeth begin to shift because we are wearing our teeth a little bit as we age, and we're losing our muscle tone of our face and our tongue, and so things begin to just do funny things. So you may have had great teeth until you hit, I don't know, some people tell me childbirth, you know, other things, but you know, you begin to notice things shift. So you notice your teeth are wearing, maybe you notice that you're getting gum problems where you're noticing your gum is receding, and your general dentist is talking to you about gum grafting procedures. You know, unfortunately, sometimes adults end up losing a tooth. They get you know, a big cavity or a crown breaks, need a root canal that went bad. You know, these things happen, and so orthodontists can help to either camouflage the missing tooth, or we can help prepare to get an implant or a new false tooth placed in. So orthodontists can really provide a lot of different services for adults. In addition to crowding, spacing, you feel like your teeth stick out, they protrude. We can, all of those things we can fixable, adjust for you. But there are some other things that are kind of, typical, not that we think of maybe for an orthodontist, but we can really help with some general dentist procedures to enhance them so that what the general dentist does, it looks even better.
So someone, we should still go to our general dentist for regular.
Absolutely, because your orthodontist is not going to be checking for cavities. They're not going to be monitoring your cleaning. We want you to have good hygiene, but we're not going to be tisk, your gums look a little puffy, So you definitely still need to be seeing your general dentist every 6 months for your cleanings, but your orthodontist can be working in conjunction with your general dentist to ensure that you get great treatment and a great result.
Thank you. That's really good information. Before I got my braces, I really was very confused and I was kind of hesitant to wear metal braces. And so I've done some research. That's probably the first time I put a lot of research into something because I was going to have it on for so long. So, for someone, let's say my age, wanting to get braces, do they have to go with the metal braces or are there other options they can explore?
It's so great. There are, of course, metal braces, which are a great option. They're the tried and true. They're very durable. They're wonderful for children because, rough and tumble, they handle well. But, for adults, maybe they're not everyone's first choice. So there are clear braces, ceramic braces is what they're made of. They're metal free, which is really nice because sometimes I know adults are concerned with metal allergies.
Are these kind of like the retainers that we wear?
Well, no, these are actual braces, but they're made out of ceramic, so they're tooth colored, so they're a lot less noticeable, and it's a great way to, go about braces without it being right in your face that you've got metal braces on. There are, though, what you're talking about, the clear retainers. The brand name that most people know is Invisalign. And the way that works is there are a series of clear retainers that you wear, and over time, your teeth become straighter, your bite improves. And they're a wonderful option as well, though the main difference is that you, as the patient, are in charge of having to remember to wear them. So, if you don't wear them, they don't work. So the benefit of the clear braces is that they're permanently on your teeth until your orthodontist removes them. So for somebody who maybe is concerned that they know themselves, they lose their glasses all the time.
Don't want to look all geeky.
So you have to know yourself, but Invisalign is a wonderful option as well. It maybe is not a great option for teenagers who are losing things all the time, but we take it case by case. And certain cases lend themselves very nicely to Invisalign. Other cases maybe perhaps are slightly better with braces, but that would be a discussion that you could have with your orthodontist.
And, you definitely have to be very disciplined, I guess, with Invisalign. And I know, I want to say what you've shared with me, that in my case, it was going to be more effective that I do the metal as opposed to the Invisalign.
Well, because the Invisalign, you can take them on and off. When you're not wearing them, it's not working. So it really can increase your treatment time potentially. So.
Well, thank you so much. This is a lot of information. You've covered some of the key questions that typically people inquire about, any ortho-related work. And I know I'm more aware now after meeting you, and I'm sure our viewers would be more, or actually willing to go and check with an orthodontist after hearing you today. So anything else you want to share with us that we might not have covered today?
Well, I just want to encourage anybody who's out there who's maybe thought about improving their smile but has been not sure how to go about it, or afraid of having to wear metal braces, go see your orthodontist. Talk to them about what the options might be. And for your children too, it's never too late to improve the situation. And really for children, it's never too early to bring them in for a consultation.
Wow, Dr. Jones, thank you so much. I have to say I'm more aware of my teeth and after meeting you, and I'm sure our viewers will feel the same way after hearing you today. Thank you, and I wish you best of luck with your practice and everything that you're doing for this community.
Oh, thank you so much.
Thank you so much. That brings us to the end of this episode. I hope you found this segment very informative, and if you enjoyed it, and would like to see more related topics or want to be on the show as a guest, please email me at limelightwithmasuma@gmail.com or call me at 703-646-0098. So until we meet again, yet with another very interesting topic, stay happy, stay healthy, and enjoy life. Thank you. Bye.